everyone, returning with Rahma Dania. We are here today to talk about something incredibly vital to our long term well being high blood pressure. While it might sound like just another medical term, understanding and managing it is one of the most powerful things you can do for your health. Throughout this presentation, we will explore the what, why, and how of hypertension, giving you the tool and insight to either prevent it or effectively manage it, ensuring a healthier, more vibrant life for yourself and your loved one. So, let's begin. What is blood pressure? Blood pressure is the force of blood pushing against the walls of your artery as your heart pumps blood around your body. It's a measure of how hard your heart is working to circulate blood. Blood pressure is not constant, it fluctuates naturally throughout the day and is affected by various factors like body position, emotion, and exercise. A normal blood pressure reading for most adults is below 120 over 18 millimeters of mercury. Blood pressure that's too high raises your risk for heart disease, but blood pressure that's very low can also cause issues. Seeing a provider for yearly blood pressure checks can be life-saving. Because we usually can tell what your blood pressure is just by how you feel. The only way to know your blood pressure is to measure it with proper equipment. This typically happens at your healthcare provider's office, and you can also check your blood pressure at home, but this shouldn't replace seeing your provider. Next, what is high blood pressure or hypertension? When the pressure in your blood vessel is too high, 140 over 19 millimeter of mercury or higher, it is common but can be serious if not treated. People with high blood pressure might not feel symptoms. The only way to know is to get your blood pressure checked. So, why is high blood pressure dangerous? High blood pressure, also known as hypertension, is dangerous primarily because it's often a silent killer. This means it usually has no obvious symptom until it has caused significant damage to various organs in the body over a long period. The constant excessive force of blood pushing against the walls of your artery can lead to a cascade of serious health problems. So, hypertension can damage your artery. The sustained high pressure stresses and damage the inner lining of the arteries. This damage makes the arteries less elastic and promotes the buildup of plaque, of fat cholesterol and other substances on their walls. This process is called atherosclerosis. Arteries become stiff, narrow, and less efficient at transporting blood. The second one is increased workload on the heart. And when the artery becomes stiff and narrow, the heart has to pump much harder to push blood through them. This increased workload causes the heart muscle to thicken. Over time, a thickened heart muscle becomes less efficient, stiffer, and eventually weakens, leading to heart failure. And it can damage major organs. The chronic damage to blood vessels affects the blood supply and function of vital organs. The first organ is heart, leads to heart attack, and the next organ is brain. increases the risk of stroke due to block of blood vessel in the brain and can contribute to vascular dementia, impaired thinking and memories. Next organ is kidneys. Damage the tiny blood vessel in the kidneys responsible for filtering waste, leading to chronic kidney disease and potentially kidney failure, requiring dialysis or a transplant. Next, who is at risk or risk factor? Things that increase the risk of having high blood pressure include older age, genetics, being overweight or obese, not being physically active, high salt diet, and drinking too much alcohol. Diagnosis. How do we know? People with very high blood pressure, usually 118 over 120 or higher, can experience symptoms including vision changes, anxiety, confusion, buzzing in the ears, nosebleed, abnormal heart rhythm, severe headache, chest pain, dizziness, difficulty breathing, nausea, vomiting, and blurred vision or other. How to managing high blood pressure? Lifestyle changes. Lifestyle modifications are incredibly powerful in preventing, treating, and controlling high blood pressure. In many cases of pre-hypertension or stage 1 hypertension, these changes alone can bring blood pressure down to healthy levels. Here are the most impactful lifestyle changes. The first one is adopt a heart healthy eating plan. The second one is get regular physical activities. And the third one is maintain a healthy weight. Next is limit alcohol consumption. The next is quit smoking, quit smoking. And the last one is manage stress and have enough sleep. And how to managing high blood pressure, medication if you need it. While lifestyle changes are the foundation of blood pressure management, they are often not enough for everyone. In many cases, especially for those with higher blood pressure readings or significant risk factor, medication becomes a necessary and highly effective tool to bring blood pressure down to a healthy range and prevent complications. This important consideration for medication doctor decision. Next, question and discussion time. So someone already asked me about the DAS diet. The question is, can you give an example of a DAS diet meal? Okay, this plan emphasizes fruits, vegetables, whole grains, lean protein, and low-fat dairy, while being low in sodium, saturated fat, and added sugars. And there's a daily calorie goal approximation. It's 2000 calories. Adjust portion sizes based on your individual calorie needs. Okay, next. To underscore this point, I turn to a powerful quote by Deb Hip. I am determined to manage my high blood pressure with medication and a healthy lifestyle. So, what's the most important thing to remember for our discussion? It's that understanding high blood pressure isn't just about knowing the risk, it's about seizing the opportunity to act. I urge each of you to take the first crucial step, whether it's scheduling a blood pressure check, starting a new walking routine, or simply being more mindful of your diet. Every small step contributes to a healthier you. High blood pressure is manageable, and with consistent effort, you can significantly improve your quality of life and add healthy years. Thank you for being here today and investing in your most valuable asset, your health. See you next week.